Hello and good day, everyone. Thank you so much for joining. All right, I'm Iman and I'll be your moderator for this evening. I hope everyone is in the pink of health despite this very challenging time. And on behalf of the team, we are very pleased to have everyone here at our live forum on COVID-19 and youth, health, and economic perspective. I would like especially to welcome all of UiTM's staff and students and everyone else who's joining our live stream and on the replay. So we are going to cover on a lot of ground for the next 1 hour. So I'll keep this introduction part very brief. Just a quick word on technical issues. If you get bumped off from this live forum, you can always rejoin it back, or you can simply watch us on the replay. And if we are the one who's having the technical difficulties and we freeze for too long, of which we are truly sorry if that were to happen, we will try our very best to rejoin and keep this session going. Just to inform our dearest viewer that we'll be having a Q&A sessions after the final round. So the three most relevant questions will be picked. All right. In addition to that, okay, we also have a question to be asked after each round to our viewers. So there'll be 3 questions in total. Okay. And our team will select the most accurate and the fastest answer on our live on the comment section. Okay, viewers can answer the question on the comment section of your respective platforms such as Facebook or YouTube. And the format for you to answer this question is very simple. You just have to put the number of the question and your answer. All right. With that, I'll introduce our panelists very briefly and straight away jump to our first round. Okay. So we have with us today a 3 wonderful panelists. Okay, so the first one we have Muhammad Helmi Husaini bin Rusmidi. He is from Malaysia, a final year student of Bachelor in Biology from UiTM Perlis, Malaysia, a former fellow Perdana to the Minister of Health, a numerous receiver of award and recognition, such as the Bronze Award uh, for the third International Malaysia Indonesia Thailand Symposium on Innovation and Creativity 2019, a multiple involvement in leadership, such as multiple time of holding the top tier position of Students' Representative Council, being selected by the Chief Minister himself to be the Perlis member of the Youth Consultative Council 2019, and also the University Ambassador for Northern Zone 2017-2018. Moving on, our second speaker, Mr. Muhammad bin Abdul Majid, is currently residing in the United Kingdom, a final year student of Bachelor of Economics from Warwick University, Coventry, United Kingdom, a former fellow Perdana to the Minister of Entrepreneur Development, second best speaker of Manchester Intellectual Debate, an overall best speaker of International Islamic University Malaysia Inter-School Debating Championship, and former research assistant to Professor Edmund Terence Gomez, the Dean of Economic Faculty, University of Malaya. And lastly, we have our third speaker, Mr. Muhammad Farhan bin Muhammad Rawi. He's currently residing in Taiwan and awardee of Taiwan International Cooperation and Development Scholarship 2020, currently studying Master in International Health from National Yangming University, Taipei, Taiwan, a former fellow Perdana to Minister of Health, Datuk Sri Adham Baba, been exposed to a lot of international exposure and community project, a Malaysia delegate to the 7th World Congress, University of Hawaii at Manoa, Hawaii, United States of America. He has a very strong interest in public health and very passionate to become one of the public experts in the future. All right, then, let us start with the first round of our discussion this evening, by hearing the thoughts of our panelists on how this pandemic has actually taken over the world. With that, let us hear from our first speaker, Mr. Helmi.
Right, so Assalamualaikum warahmatullahi wabarakatuh, and a very good evening to everyone. First and foremost, thank you, Mr. Iman, as the moderator for tonight. Hello and hi, Muhammad. So Muhammad is currently in United Kingdom, while Farhan is currently in Taiwan. And hi everyone who is like watching this live. First thing first, I would like to thank Majlis Perwakilan Pelajar, Unit Kepimpinan Pelajar, and also PDHJ UiTM Perlis for inviting us for tonight forum or webinar. And to be honest, I'm quite nervous to start the discussion because
We all
we
are.
are having the discussion with the great figures here. Anyways, like back to the question, briefly introduce of how this pandemic has taken over the world. So I will be explaining this question in two main aspects, which is the health and also the economic perspective. So as in Malaysia, back to the history, back to the world, on 12 December 2019, we have like an unknown acute respiratory tract infection was reported in Wuhan city in China. And in Malaysia itself, the first Malaysian was confirmed with COVID-19 was on the 4th February 2020, which is 9 months ago. And now Malaysia is entering the third wave, of which the third wave is driven by cases from clusters in Sabah and Kedah, with Selangor also recording a notable increase in the cases. And to this date, Malaysia has recorded, today, we have around 1,009 new cases, making the total cases as 36,434 cases in cumulative. And as for today, 70.4% of Malaysian citizens who is infected with this COVID-19 has recovered. That is basically what is happening in Malaysia based on the health perspective. In terms of the economic impact of this COVID-19 in Malaysia, what is happening? Supposedly, this year is Visit Malaysia 2020, of which this campaign, the Visit Malaysia campaign, aimed to attract around 30 million tourists arrival, has also been cancelled due to this COVID-19 crisis. That is of concern as the tourism industry of Malaysia is a major source of foreign exchange in national economy. The tourism contributes to more than 50% of the export trade in service. So with this pandemic, it actually impacted Malaysian tourism. We usually receive like around 27 million tourists every year. And due to this pandemic, it has affected the tourism industry. And I think like not Malaysia alone has impacted or affected with this pandemic. All over the world, the countries all over the world are also like impacted with this COVID-19 pandemic. And it has like shocked the world economic structure, which is now in the state of the uncertainty. And according to a report by the Malaysian Institute of Economic Research, the Malaysia GDP growth will contract by 2.61% in 2020. And it is like also estimated by Bank Negara Malaysia that 951,000 people will lose their jobs for this year. And I can see it is happening around me. Most of my colleagues, most of my family members, and the people around me are losing their jobs due to this pandemic. We are in the same storm, but we are not in the same boat. So another thing, another important thing that is happening, like in terms of the economic impact of COVID-19 in Malaysia, the Malaysian Global Innovation and Creativity Center predicted that about 40% of the small and medium-sized enterprise have to close up their operation if the COVID-19 chain of infection persists. So I think that is brief enough to explain what is happening in Malaysia right now. Basically, in terms of the health and economic perspective, the case keep on rising. Malaysia is one of the countries that has the high cases in Southeast Asia. And in terms of economic impact, I think the whole world, the whole country is affected with the impact. However, in terms of the unemployment rate, people who lose their jobs and whatnot, Malaysia is facing it. And we hope that with the initiative or measures taken by the government or the authorities could actually like curb this pandemic. At least the impact in health and economic perspective. I think that's it, Mr. Iman, about what is happening in Malaysia. Basically, how this pandemic has taken over the world in terms of the health and economic perspective.
Okay. Thank you so much, Mr. Helmi, on your insight. All right, so let us now moving on to our second speaker, Mr. Muhammad.
Thank you, Iman. Assalamualaikum, and I guess good evening. It's still afternoon here.
Yeah, yeah.
Um, yeah. But anyway, oh yeah. First of all, thank you to MPP UiTM Perlis for inviting me. I think Iman has oversold me a little bit. But yeah. Um, anyway, I think Helmi just now had, despite having no prior backgrounds in economics, I think Helmi had succinctly explained on the economic impact of COVID-19, and I think he focused more on Malaysia. And today I like to give like a more global, or I think more special emphasis on the UK. I think Helmi made a very important point just now. He said that it affected tourism. I would elaborate and say it does not only affect tourism, but it affects almost every other sector out there. But tourism is a very good example because we know because of this thing, international tourism especially has been hindered a lot, has been affected a lot by this. Aviation companies are closing down. We even know in Malaysia, Mas and even Air Asia. But anyway, first of all, I would like to tackle this question. Uh, how is this recession different from the ones that we have faced previously? Okay, so we have to go and compare it with the previous economic recessions that we had before. For example, we have the 2008 financial crisis. It's called the global financial crisis. And it's called financial crisis for a reason, because it stems from the financial industry. But this current economic crisis that we're facing, we call it an economic crisis because it is primarily a health issue, and then it somehow, affect all other industries out there. And we can see that the 2008 financial crisis, it was primarily because of the subprime mortgage, financial instruments that was originated from the housing market in the US. And even in 98, they call it the Asian financial crisis because it did not affect the West as much as it did affect Asia. It was because of currency speculation. It wasn't really, because of this health issue. So this is somewhat a unique recession that we're facing. I would say it's the worst that we have seen ever since the Great Depression of the 1920, 1930s. But anyway, moving on to the UK specifically, to really understand the impact that COVID-19 has on the UK, we have to understand first the situation that UK was in before COVID-19 and post COVID-19. Okay. How was the UK before COVID-19? We know UK they had just decided they voted on Brexit, and it was decided, and the people's voice decided that they wanted Brexit. And because of Brexit, and even till today, they did not have come to an agreement. The UK and the EU, they have not come to a proper agreement between. Oh, okay, 2 minutes. Anyway, they have not properly come to an agreement, as in their trade conditions and everything, and this has caused a lot of uncertainty in the UK. And suddenly, this uncertainty, was compounded with the advent of COVID and has further exacerbated the uncertainty. And this is just terrible for the economy. Helmi just now used GDP as an indicator to measure the economy. I think it's a good indicator. Of course, it's not completely indicative of the economy, but it is indicative of economic growth and the situation that we're facing. I think I have a few other things that I would like to bring out, such as rising inequality, unemployment, but I think I would further elaborate more on the effects that these things have on like certain segments of society, maybe in the next round. Oh, by the way, UK now is like facing a lockdown. Actually, it's midnight. Like in Malaysia, we have this thing called the zone hijau, zone kuning, and zone merah. In the UK, we have a similar lockdown restriction, but it's called tier 1, tier 2, and tier 3. But tonight it's going to be worse. Like it's going to be like the highest tier. It's called lockdown. It's not even tier 3 anymore. Yeah.
Okay.
Mm.
I hope you're doing great, Mr. Muhammad. All right, thank you so
Inshallah.
much, Mr. Muhammad. Now let's hear from our last speaker for this round, which is Mr. Farhan.
Okay, Assalamu alaikum and a very good evening from Taipei. So thank you, Saudara Iman, for the introduction and the question for this first round. And of course, thank you for the organizer for inviting me to be one of the panels. All right, so I'm happy to share with the audience tonight the current situation in Taiwan during this world pandemic. And as we all know that the world has now reached over 40 million plus number of COVID-19 cases, with over 1 million number of deaths worldwide. But Taiwan's hold the world best virus record by far of 200 days without local cases. Since its last local case came on April 12th this year, and there has been no second wave so far, and the community transmission has been successfully eliminated. According to Taiwan Centers for Disease Control, there has been 568 total number of confirmed cases and 7 deaths in this island with 23 million population. And even Taiwan is 81 miles off the coast of the mainland China, and it was previously and initially expected to have the second highest number of the COVID-19. But it because due to its proximity to and the numbers of flights between China, but it is not happening. And as compared to United States, which is geographically distant from China, but now the United States has seen the highest record for the COVID-19 cases and death in their community. And out of 568 officially confirmed cases, 478 were import, 55 were local, 36 came from the Navy ships called Goodwill Fleet, one unresolved case, and there is one case, case number 503, have been removed from the confirmed cases. Up until now, seven individuals have succumbed to the disease, and 521 have been released from the hospital isolation, and leaving 40 patients still undergoing treatment in Taiwan. In terms of daily economic and social activities are not seriously affected here, fortunately. And everyone here can still live like a normal life. You know, kids go to school, parents go to work, and also you can enjoy your brisk walk at the park, etc. But still, practicing safety measures such as wearing masks, and also mainly at the campus and also the public transportation and avoid crowded places is very much well adapted by the community here in Taiwan. So, however, speaking of that, Taiwan still isn't out of the woods yet. The government has recently confirmed the 3 imported cases from the Philippines, from United States and Indonesia. And in the past 2 weeks, there have been recorded over 20 imported cases in Taiwan. And Taiwan will also likely become one of the few economies to grow this year, with government forecasting in August, the country's GDP will expand at 1.56% in 2020. And latest GDP data for the second quarter, in fact, during that time when during the second quarter when other countries have seen a massive increased number of COVID-19 cases and deaths worldwide, but Taiwan had the smallest economic contraction at only 0.6%. And all thanks to their efforts in early closing borders, travel restrictions, rigorous contact tracing, technology enforced quarantine, and widespread of mask wearing. And the painful lesson of the past epidemics paved the way of Taiwan's success in fighting COVID-19. And I think for the first round, I will leave that there first. Right, thank you.
All right, thank you so much, Mr. Farhan. So from this first round of our discussion, we can conclude that about 70.4% of Malaysian has recovered from this virus, and this virus has not only affected the tourism sector, but also every other sector. And we can learn that Taiwan is the lowest country of the cases, right? As mentioned earlier, we have a question for our viewers and a mystery gift for answer that matches our criteria. Okay, so please listen to the question carefully. Which country that has initiated immediate lockdown as per mentioned by our panelists? I repeat the question once again. Which country that has initiated immediate lockdown as per mentioned by our panelists? All right. Without this, I think I've mentioned before that our viewers can answer the question at the comment section of your respective platform, which is Facebook and YouTube. Okay. So without further ado, let us proceed with our second round of discussion. And at this round, we are going to look into on what are the current initiatives that have been taken by the authorities to tackle or to curb this pandemic. Let us hear from our first speaker, Mr. Helmi.
All right. So basically, thank you, Iman, for the question. What a lovely question. All right. So, what are the current initiatives that have been taken by the authorities to tackle this pandemic? Also, will be discussed in two perspectives or two aspects, which is the health and economic. So, first, we go and look into the health perspective. What did the authorities do? So, to enhance the Ministry of Health effort in keeping the spread and mortality rate under control, a movement control order, the MCO, was implemented on March 18, 2020. I'm sure that Farhan and Muhammad also experienced the MCO during the March 18, 2020, since you are here in Malaysia during that time. So the MCO related to the restriction of movement of people into or out of an area, meaning that no one can go into any place. And then the Director General of the Ministry of Health emphasized that the order enforced came under the Prevention and Control of Infectious Diseases Act 1988 and the Police Act 1967 and would help to control the spread of the virus. And the health strategy of the Malaysian authorities have been shifted from isolating or quarantining everyone who is infected to encouraging people who have at least the symptom to stay at home. This strategy is beneficial as healthcare facilities will not be overwhelmed and may not become the source of virus spread to other healthcare staff and patients. And if this measure was not taken, I'm pretty sure that we, Malaysia, will have more cases than we have today. And then in terms of health perspective as well, Malaysia has increased up its testing capacity from around 1,000 tests per day in January 2020 and increasing it over 38,000 tests per day until today. We are having like 38,000 tests of COVID-19 per day, from 1,000 in January up to 38,000 in now. I mean, like starting like from June. The COVID-19 cases were contained by isolating all asymptomatic and symptomatic patients to hospital for free, regardless of citizenship. And another measure taken by the Ministry of Health to cushion the impact of COVID-19 was the setting up of a special fund known as the COVID-19 Fund to raise money to be channeled to patients, particularly those affected financially due to the quarantine procedure. So basically, those who lose their job or cannot attend their job when they have to self-quarantine or they have to quarantine themselves, they will be given like 100 ringgit per day. So that is the function or the initiative taken by the Ministry of Health to cushion the impact of COVID-19 to the human being. I mean, like to the affected people. And then that is about the health. And then we have, the Ministry of Health and for us, the people to wear masks, taking care of the physical distancing and whatnot. Same as what Farhan said just now. What is happening in Taiwan, we did implement it in Malaysia during now. And then in terms of the economic perspective, Muhammad could like explain it, in a better way. So what did the government or the authorities do to tackle this pandemic in terms of the economic perspective? At the end of February 2020, the former Prime Minister of Malaysia, Dr. Mahathir Mohamad, he has like announced a 20 billion financial stimulus package intended to mitigate the impact of COVID-19 based on three major strategies. First one is to lessen the effect of COVID-19, people-based economic growth, and the third one to encourage quality investment. And then prior to that, after the first package has been announced by the former Prime Minister, the Prihatin package amounting to 250 billion ringgit was announced. The Prihatin package has provided governmental support to society, covering people of various backgrounds, from students and families to business owners. And this strategy actually aimed to stimulate the travel industry, easing the cash flow and providing support to affected individuals. So we go local. Since like Visit Malaysia, I don't call it as cancelled. It's still happening, the Visit Malaysia, but we actually in Malaysia we encourage the Malaysian to travel around the Malaysia.
Local tourism instead of international tourism.
Yeah. And then among the approaches that has been taken by the government is that we ease the financial burden of the hospitality industries, giving the discount amounting to 15% off of the electricity bills for travel companies, airlines, hotels, shopping malls, and exhibition, as well as the convention center. Because they are not operating, so the government make the decision to actually give discount to cut off like 15% of the electricity bills. And there's like many more, like the scheme or what we call as the Prihatin package that has been announced by the Prime Minister, by the government, by the authorities. And we can see that with the help of the authorities, with the implementation of certain things in Malaysia, such as the movement control order, the Prihatin package and whatnot, it has like helped to ease or to curb the COVID-19 impact, particularly in the economic and also the health perspective. However, as we are witnessing now, we are entering the third phase. I really hope that with the current, current initiative that is taken by the government or the authorities, we could actually like curb this pandemic in the future. Yeah. So I think that's it. What did the authorities do in Malaysia, Iman?
Yeah, okay. Right, thank you so much for your information, Helmi. So now let us hear from our second speaker once again, Mr. Muhammad.
All right, thank you very much. So what have the authorities in the UK did in order to combat this COVID-19 thing? So I think we just now we made a distinction between the health impact and the economic impact of COVID-19. But I think when it comes to policy making in tackling this pandemic, although we can actually like put this distinction between the two, but when it comes to policy making, it has to be done in an integrated way. The reason I say this is because I think in the UK there's sort of this perception that there's this trade-off between the economy and health. For instance, if you do lockdown, then you don't have economic growth, right? So I think this mentality is somewhat flawed because economics is basically it's basically a social science, and the goal of economics is basically to improve the welfare of society. And when you think of economics when you think of economy as something like you want to improve the economy, but then it will affect society, then I think this tension between the two is not supposed to be the way we understand the economy. That's point number one. But anyway, the reason I say that is because I think the UK has been quite loose in their lockdown regulation. Well, to be honest, the regulation is okay overall, but the enforcement of those regulations are just terrible. I mean, during the lockdown in Malaysia, people just can't go outside. Like the police will be asking you, what are you doing here, right? But in the UK, you can just be outside and do whatever you want to do. And yeah, even when the Prime Minister of UK, Boris Johnson, he said that he announced the lockdown, he even said that, oh, you can still go outside, once a day to jog and everything, which I think is just preposterous if that was the thing that is said in Malaysia. Imagine Muhyiddin, Prime Minister Muhyiddin comes out with his perutusan khas and say, macam, oh, you still can go outside once a day. I mean, who are there to monitor whether your movement is once a day or twice a day? Could even be the 11th time. Yeah, no one would know. Yeah. So in terms of their enforcement, it's quite bad. But in terms of their regulation, I think on paper it's quite good. But then there are some loopholes. For instance, they say you cannot have more than 6 people gathered in the same household. But on the other hand, you still have pubs opened. I think in some places they even have clubs. Yeah, so hence why the situation, I think, because today we have people from, we have panelists explaining about Malaysia, we have a panelist explaining about Taiwan, we have a panelist explaining about the UK. And I think if we were to put these 3 countries in comparison, the UK is by far the worst. The best being Taiwan, and Malaysia is, it was almost up there, but then the third wave came, and yeah, it's somehow in the middle again, and it's still fighting again. But yeah, so I think if we ask the question about, if you're asking the question, what did the UK authorities do in order to combat COVID-19, we should bear in mind that it is not something to emulate. It is something to avoid. As in, I'm not saying it's everything, but then this loose enforcement of regulation, I think, is something. But then again, as I pointed out just now, the UK at midnight today is facing another lockdown. And I think that's a very good proactive initiative done by the government of the UK, seeing that, given that winter is coming, and COVID-19 will just thrive during winter. So I think we're going to a lockdown for 4 weeks, which is good. It's supposed to end by December, but I think it's given that, yesterday we just had an increase of 25,000 cases, and now in total the UK has recorded 1.1 million cases, in fact. And yeah, yesterday alone we had 500 cases, 500 deaths, sorry. And if this were to happen in Malaysia, people would be panicking all around. But then yeah, so I think
True.
on one side, you cannot really blame the UK government, because I would say the mentality here is also quite, it's quite bad. Especially from the people, you can just see them walking around without masks and everything. So I think
Usually it's very chill.
good. Yeah, they're too chill, kan. Although it's good that no, it's not good. It's terrible. The question just now, macam I think Iman pointed, like, what did the authorities do? But at the same time, when we answer this question, we have to bear in mind that it's not up to the authorities alone. The people have to be compliant as well. Not just because, oh, the lockdown says this, enforcement is not strict, so you become irresponsible and just go around and everything. So yeah, there has to be that balance. But anyway, I would say in terms of the economy, I think there's one thing that I really like about the UK, and that is they are not afraid to spend. The fiscal stimulus here is very good. Thus far they just spent around 190 billion pounds sterling pumped into the economy, yes, to help with this pandemic, and that's amazing, because I don't think, previously in the economy debate, we usually have this debate between free market and state intervention, and some people say, oh, we should just leave everything to the market, let the market fix itself, but now this sort of free market thinking is no longer there, because we all know that in such an unprecedented crisis like this, we just have to spend. We have to cushion the impact as much as possible, because if we don't do it now, then it's going to have a deep long-term impact on the economy. So that's one thing that we can praise the UK government for. And I think another thing is called, there's this package called the CJRS. I think it stands for Coronavirus Job Retention Scheme. So basically, the UK government would subsidize um, firms to pay wages to their workers that are on furlough. On furlough ni maksudnya who are taking leave of absence. Yeah, so they're not doing any work because they can't do any work. Maybe because the nature of their job is such that they cannot do the work from home. You know, some people have the luxury to do work from home. We have internet and everything, but some jobs just cannot be done from home. It has to be done physically. And I think this CJRS stimulus is a really good thing. And I think today, in fact, the UK government has another announcement to make regarding this fiscal stimulus pumping and injection into the economy. But they haven't made an announcement, so I think I can't say anything. But I think the Bank of England is basically the central bank of the UK, has just decided to pump in more money into the economy, not by printing, but it's a device called quantitative easing. It's a bit technical, but basically they just pump in more money into the economy. I think by 150 million, if I'm not mistaken. Yeah. So that is about the economy. Yeah, I think that's it for now.
Okay. All right. Thank you so much, Mr. Muhammad. I hope you're doing okay.
I hope
Especially that
so
you'll be
too, yeah.
having the lockdown tonight, right? You'll be
Yeah,
having
it is.
the lockdown this midnight, isn't it?
Yes,
I hope you're
midnight.
doing great. All right. So let's move on to our last speaker for this round, Mr. Farhan.
Okay, thank you, Iman. All right, so for the second question, which is what are the current initiatives that have been taken by the authorities here to tackle the pandemic? I think for the first thing is that we have to know that Taiwan was the first nation to implement the proactive measures against the novel coronavirus. And in fact, on 31st December 2019, Taiwan was the first nation to inform the World Health Organization of the potential for human-to-human transmission of the novel coronavirus in Wuhan, China. And as a precaution, the government of Taiwan started to on-board health inspection of flight passengers from Wuhan to Taiwan. And I think, therefore, I think this is very crucial as how significant of early government response to the outbreak could result in order to contain the virus spread. So other than that is that one of the key factors in Taiwan's success story has been the use of innovative information technology, the big data analytics, and which works splendidly well with the National Health Insurance and also the National Central Epidemic Command Center, CECC. And I would say that this very well integrated system has played a vital role and have been really useful and helpful for the authorities to control the spread of COVID-19 in Taiwan. And there are three measures have been identified by many researchers as critical steps in controlling the spread of this virus. One is contact tracing, second is testing, and the third is quarantine or isolation treatment. And effective execution of the mentioned measures demonstrate an effective leadership and a strong public health infrastructure in the country. And for the viewers' information, Taiwan had established its national health insurance system in 1995 and uses a reimbursement system to guide and prioritize the nation's healthcare organizations. The past bitter experience of SARS in 2003, Taiwan has been determined never to be caught unprepared for another pandemic, and they have dramatically strengthened since then their pandemic control measures. And this include developing hospital SOPs to address highly contagious diseases. And also the National Health Insurance Administration have developed two forms of information technology that are very critical in its pandemic preparedness and control. So what is the information technology? The first one is the NHI Smart Card, which is that allow all providers real-time access to upload patient records and claims. And the second one is the MediCloud system, which was developed in 2018 that provide providers and patients real-time access to patients' health records, including diagnostic and also prescriptions. And in fact, on February 18, the government announced that all the hospitals the clinics, the pharmacy in Taiwan, they would have access to patients' travel history as well. So the Central Epidemic Command Center that was established right after the SARS in 2003 was also immediately activated on 20 January 2020, and even before Taiwan had its first case. And it incorporated the National Health Insurance Administration and MediCloud into pandemic system control system, and used the MediCloud system to develop a real-time alert system by linking it with the immigration data. And because of the system, the healthcare providers were able to obtain patients' travel history, occupation, contact history, and clustering at mass gatherings in real time. And this has made the situation becomes even more efficient with the information system, especially for Taiwan's precision testing strategy in testing a small but critical number of people instead of mass testing. So the MediCloud has also been instrumental in facilitating Taiwan's universal access to ration, the use of the surgical mask. And other than that is the use of technology of Taiwan's contact tracing and quarantine monitoring, which is a GPS-based information system called Intelligent Electronic Transfer System. And it is collaboration between CECC and also mobile phone carriers that was developed in early February. And the system can actually detect the location of the quarantined individuals. And it also monitors the entire nation's quarantine population and any potential people that they may have come contact with, and it can track them in real time and retrospectively for up to a month. And for example, that before this, if you in a quarantine, you were not allowed to actually put the airplane mode for your phone. So because the government will use your phone to monitor your location actually. Otherwise, the police will go to your hotel and will ensure that you are not outside of the hotel. And this happened to my friend actually. And Taiwan's pandemic control measures were complemented by effective social care as well as free access to testing. The government also financed the cost of 14-day quarantine. Everyone under quarantine was compensated, but with $35 per day. And the local government staff make daily phone calls to those under quarantine to offer assistance and provide them with a care package that includes surgical masks, detailed instructions on quarantine, free online access to exercise videos, and free online access to movies. And Taiwan's government recognized that the general public are a crucial partner for the success of the pandemic control. And lastly is that Taiwan is planning ahead for a potential resurgence of COVID-19 in the fall. And by accelerating vaccine and drug research, expanding medical research and capacity, while improving its border inspection and also quarantine measures that can accommodate reopening borders for commerce and also travel purposes with a world that is not as safe as in Taiwan. So I think that's all for now. Thank you.
Okay, thank you so much, Mr. Farhan. As just now you mentioned about Taiwan has this smart card. Is it like a physical card or a virtual card?
Yeah, it's a smart card actually. It's just like
It's
your
physical
ID
card.
card. Yeah, it's a physical card.
Okay,
And
okay.
so everyone here will have that card, and also whenever they go to the hospital, they will be able to the doctors will able to access to the patient's prescription and diagnosis previously.
Okay, so basically that card holds all the information.
Yeah, so they can
Okay,
get
all
the
right.
real
Okay,
time
thank you so much.
data.
Oh, all right. Thank you so much, Mr. Farhan. All right, so from this round, we can conclude that it is just not the authorities, but it is on us, the citizen of respective countries, to be, to be very well to combat this pandemic. Okay, it's just not, you can't rely on the authorities as well. It is on you as well. Okay, so as like the previous round, sorry, we do have a question once again for this round, which the question is, which country is the most efficient in tackling this pandemic, as mentioned by the panelists? I repeat the question: which country is the most efficient in tackling this pandemic, as mentioned by the panelists? So once again, you can answer the question on your respective platform on the comment section. All right. With that, I think we can move on to our third round. And this round, basically, this will be the last round actually, and we are going to focus on the opinions of our panelists. Okay. So, in your opinion, what are the future preparations that could be taken if this pandemic hits again? So let's hear from our first panelist, just like before this, Mr. Helmi.
All right. So thank you, Iman. So this is like it is like about opinion of which if this pandemic hits again in the near future, what we could actually do, not
Yeah.
the authorities alone, but us as well. So basically, one of the thing, in my opinion, that we can do is to fully utilize the big data in predicting the future pandemic. So big data, as all of us know, we have like heard that term like millions of times. Big data is a term that describes the large volume of data, both structured and unstructured. And the most important thing about the big data, it is not the amount of data that is important, but how or what the organization do with the data that matters. So in both national and global epidemics, big data has advanced to a place where it can provide emergency response teams with real-time tools and technology that have the potential to monitor, contain, and even stop the spread of the disease. When used effectively, these tools have the potential to save life. So we really need to fully utilize the big data. The process of, like the process of tracking and predicting the trends in the midst of the epidemic, natural disaster, and other emergency has often been left to the private sector. This I couldn't like deny it. The private sector who are the one develop this kind of big data to actually predict the future pandemics or something like disasters or emergencies. So it is like now the time for the government or the authorities to fully utilize the big data to in order to predict the future pandemics if it happen again in the near future. So big data will allow the researchers and the health professionals uh, to actually comb through mountains of information to isolate the trends and develop solution to health issue. So as you can see, basically we have for Malaysia, we have the GCI index, if you have heard of it, of which this GCI index was launched on June, if I'm not mistaken, by His Excellency Khairi Jamaluddin, the Minister of Mosty, of which through the GCI index itself, we can actually know the trend of the pandemic, what is happening, what is the number of cases, and it will rank the countries based on perceptions and based on the recovery rate. So from the ranking itself, so we can know which country is safe to travel, which country is most likely to, at the latter stage of the pandemic. And that is like very important. That is like the importance of the big data. But we have to prepare it from now. Just be like Taiwan. Just like be like Taiwan. They are taking
Yeah.
the early measures. What the government did
Yes.
is like a very good thing in order to combat the pandemic.
Yep.
They even develop they even like develop one of the technologies since 2018, as Farhan mentioned just now. So when a public health worker can effectively utilize the wall of information to map the disease and track the outbreak in real time, it can be proven to be life-saving. The authorities can actually like predict where to send resources as well as medical personnel. Without the big data, if you like compiling the data in traditional way, you will have the difficulties, in knowing where to send the resources, where to send the medical personnel, because you don't know where is like most likely affected areas, least affected areas, of which we have to concern on the most affected areas. So with the help of this big data, how we manage the data, we can actually, send the resources to the most affected areas as well as the medical personnel. So It is like very important. And for instance, we look back during the Ebola crisis, the internal organization from the whole world, use the big data to collect and digest the real-time data and on the ground in communication to provide the most accurate and up-to-date information about the disease available. So with this like big data, it could help the public health professional in overcoming or in combating any pandemic or disease or emergencies or natural disaster. So developing and implementing effective disease preparedness measure is essential, just like what Taiwan did. So big data seems to hold solution to prepare for the future disease outbreaks, develop timely response, and save more life. So we have to actually, start to fully utilize the big data. It is not the private sector alone. I mean, like it is not the responsibilities of the private sector alone, but it is like the responsibilities of the authorities and the government as well. So I think that is like one of the important thing that I'm going to discuss. I mean, like in my opinion, what I can see in order to predict if this pandemic hits again in the future, what we can do. So we have to start fully utilizing the big data so that we can actually update on the trends, update on which areas are more likely to be affected so that we can send resources, medical personnel, and even help. So I think that is like one of the opinion. I think Farhan and Muhammad would have a better ideas in terms of the health and also the economic perspective because they are, like that is like their profession, better in health and economic perspective. So I think like we have to work together towards the big data. We don't let the burden to be on the private sector itself, but the government and the authorities have to start to fully utilize the big data in order to predict the future pandemic so that we can actually prepare. So my last words be like Taiwan. They prepare it like earlier. I mean, like they are very good. The smart card, that's like very good stuff. And the GPS tracker itself. In Malaysia, we have the My Sejahtera, but whenever someone is infected, they wouldn't like notify it through My Sejahtera. Instead, the medical personnel or the hospital will call the people. So maybe that is something that we can actually initiate for the future pandemic. That smart card stuff is very nice, very great, and awesome.
It's more
I think
efficient.
yeah. Okay.
Yeah.
So perhaps I think that's all from me, Mr. Iman.
Okay. So basically, in a simple word, big data is very important for us, isn't it?
Yes.
Okay.
Definitely.
Moving on to our second speaker, Mr. Muhammad. Let's hear your thoughts on this particular issues.
Okay. I'd like to start by saying I think Helmi had brilliantly and succinctly explained, concisely explained what we can do in the future. But I think when we speak about future preparation, this is a bit of a wishful thinking on my part. This is just me being quite idealistic. But I would really want to see the international community collaborate by sharing data, and have have a standardized measure of like maybe standardized terms as well. For instance, in the UK we have tier 1, tier 2, tier 3, and in Malaysia we have MCO or MCO. So we want to have a proper standardized term of what it means and a specific definition of these terms. What does it mean to be in a tier 1 lockdown? What does it mean to be in a red zone geography area? So this, so because I think the problem right now is that the international community, even I think some countries like China are quite secretive. They didn't really disclose the data. I mean, the data privacy is one issue about big data. It's been debated a lot when it comes to big data, and I think some countries are more sensitive to data privacy issues than some countries like China or North Korea. But then again, I think international collaboration is important. But if we were to be realistic and practical about it, I think it's also important that each country has a contingency plan. You know, what if other international community don't want to help them? I think Taiwan had learned from that because
Yeah.
during the previous pandemic, previous epidemic in Taiwan, I mean, given the political situation that they were in, I mean, they were not on good terms with China, but at the same time, it was also not on good terms with the US. The US, I mean, the global community is quite scared of taking the risk of opposing China, you know, for that to help Taiwan. So they had to face everything alone and they paid the price. But they did learn from the experience
Yeah.
that they faced. And of course,
Yes.
what they did was amazing. They improvised their public healthcare management, their pandemic management, and everything. And it's good that you learn from your mistake. But of course, I mean, it's a bit wishful. It's a bit of a wishful thinking. But I would want to see more international collaboration being done. But anyway, for future preparation, I think we have seen multiple approaches being done in when this pandemic hit. At the beginning, we see some countries they don't really want to do lockdowns, so they just resort to what's called herd immunity. So basically, you have a big chunk of the people actually contracting the disease, but somehow they develop this group, I mean, herd immunity. Um, I think the UK initially they wanted to resort to that, but of course, it's I don't think that's a good idea. I mean, but some countries like Taiwan, they actually started early. They closed. I think they were the first. They was the first country to close their borders, the
Yeah.
national border, and I think it's good. I mean, look at the results now, and I think we should not be too worried about if we do lockdowns, economy is going to be bad and everything, because I think it's quite interesting that we look at the case of the Scandinavia countries. You know, all the Scandinavia countries they actually resorted to lockdown, but Sweden. And look at the economy. I think even although Sweden did not have any lockdown, as bad as other Scandinavian countries, their economy was still, I mean, their GDP was still quite the same as roughly the same as other countries, because this is a global issue. I mean, you can't help but be affected by this. So I think we should just resort to lockdown. Yeah, I think that's one thing that we have to not be scared about. But I think it has to do with our understanding of what it means, of what economics means. Like, what is it about? Is it about growth? Is it about just about production? Or is it about welfare? About societal well-being, and our understanding of the economy, of what it is, of how we measure it, will eventually affect our policy making. Yes. What else can I talk about? Helmi talked about big data, the utilization of big data. I think that's really important because I think recently in the UK we had this incident of 50,000 cases gone unreported because of incompetent use of data. I think because they didn't really know how to use Excel, because that's like, it's a bit technical, but depending on the type of folder you use on Excel, I think there's this one folder, it's called the XLS or XJL or something.
Yeah.
When you insert data in it, there's actually a maximum of 65,000 entries. So when the entries exceed 65,000, the data will just be omitted. Also, this omission had caused lots of unreported missing data. And because of this, the track and tracing system were actually not credible for a while in the UK. And this is just, basically terrible utilization of data, basically incompetent people. So I think the point that Helmi made just now was really crucial. It's not just about the amount of data that we have, but it's also about
How we manage it.
efficiency of using,
Yes.
of utilizing the data. This is really important to understand. And of course, you know, I like this quote. I think there was someone in the WHO who said it. Our strength in combating this pandemic is as strong as our weakest link, you know, because once this thing affects one country, it doesn't matter how strong your country is, but when it affects the weak country, it will go and affect the other countries as well. It doesn't matter how strong a country is. Hence why we
Yes.
really need international collaboration. But it's a bit of a wishful, hopeful thinking. But I do really hope that we learn from our from the current uh, situation that we're facing right now.
Yeah,
Yes, I think that's it for now.
definitely.
Okay, all right. Thank you so much, Mr. Muhammad. So, like, just a quick question to you. Like Malaysia, we have the My Sejahtera app, whereby in Taiwan they have the smart card. So, what about in UK? What kind of things that they use to
Well,
track the people?
well, we do have this thing called the InHS. I think it's called InHS tracking. It's slightly
Okay.
a bit like MySejahtera, but I would agree. I would say that it is still not as specific as Taiwan's because
Okay.
remember I just told you that UK is a
Mhm.
bit sensitive to data privacy issues, so they're a bit
Hmm.
like ambiguous about like which place have actually
Okay.
it's in there and there. But yeah, I think they're quite I think they're too general about it. They don't really specifically tell you which place to avoid and which to not, which I think can be problematic. I mean,
Mhm.
it's okay to. I mean, it's important to be sensitive to data privacy, but I don't think you have to be too extreme about it because you're not disclosing any name. You're not disclosing any specific
Yes.
person. You're not
Yes.
pinpointing anyone. Yeah, so just be open about it.
Yes.
So there has to
Exactly.
be that balance about data
Yes. Exactly.
privacy. Yeah, you don't have to be like too paranoid about it. Yeah.
All right. Thank you so much, Mr. Muhammad. All right. So now let us hear the opinions of our last speaker, Mr. Farhan.
All right, thank you, Iman. I think as what we all the panels have discussed earlier and touched on many aspects of the COVID-19 situations worldwide, I think I would like to thank the panels as I believe Muhammad and Helmi have done very well in expressing their knowledge and also opinions about this matter. And Helmi mentioned about the big data analytics, and Muhammad also mentioned about economics understanding and how the economic understanding is also important in the policy implementation so that we would be able to tackle this crisis, not just in terms of public health, but also in terms of the economic implication, right? So I think from this, I would like to emphasize that as we all realize now that the world nowadays has become interconnected more now than ever, right? So
Yes.
anything happen in another part of the world or a small part of the world could reverberate to the other part of the world.
Exactly.
Yes.
So, for
Exactly.
example, who might have thought that last year, it was just last year that we had a very wonderful life, very a normal life, but
Yeah.
now everything has changed and it's completely changed, not even within 1 year. And and who might have imagined that the source of infection happened in Wuhan later becomes the world headlines of public health and social and also economic implications. And from this, I believe that we could reach to a consensus that the public health study and also awareness are highly important, especially in time nowadays. We have seen many types of infectious disease and rising of non-communicable disease and also other unprecedented conditions. And we could see how worse the implications of the public health crisis so far has done to our daily life, to our jobs, to our educations, and also to the people around us, just like Helmi mentioned in the first round. So, as Helmi mentioned just now about the public health professionals, I think hopefully we could see many public health professionals in the future and back up with a very strong public health infrastructure and policy by the government. I think that is very crucial. What I mean
Yeah.
that public health infrastructure, it includes with the big data analytics, it includes with how do you organize the healthcare organization and also how your people get access to the healthcare. And 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 hopefully by doing all of this preparation, we hope that whenever the crisis might happen in the future, whatever the next outbreak might be, it will be very brief and solvable for all of us to manage. I think that is the first one. And not to mention, our people also will fully aware of protection measures that they could have practiced in the very beginning when the situation comes again. For example, like the basic thing about the mask wearing and also physical distancing, hand washing, and the people here in Taiwan, they have learned very much from the past experience, and it has become very, very, sort of like something that automatically when this happens, so they will definitely prepare all of these precautionary measures without the government has to tell them first. So I think that is the first thing that we need to inculcate to our people, that we don't have to wait until the government decide to tell us about this is very dangerous, but we have to protect ourselves first before anything worse happen in the future. And I hope that we would not be as panicked as we have seen in early this year, with so much uncertainties, and also with physical, emotional, and also mental suffering, I would say. And other than that is both public health and economic situation for me are equally important. I have to mention that it again and again are equally important. And I think it's not about which one should come first, or public health first and then economic next, or economic first and public health. No, I think one should never be sacrificed at the expense of the other one, right? So both have to go together. And Taiwan has made the right example of how they can able to contain the spread of virus, and also the economic still going very well. And 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 with a strong and effective public health system, as well as the use of technology-based interventions, early government response, and strong community compliance with the new normal, with the new situation, I believe when the next outbreak in the future comes, we will be more prepared to contain the spread of the disease, and hopefully in the near future there will be a lot more of investments in our into our health surveillance system. For example, investment to our big data analytics. There will be a lot more of public and private health partnership, right? Not just we rely solely on the public sector or the private sector. I think the public and private health sector should be very enhanced. And I think all countries, not just Taiwan, is the best model, but I think all countries have done well. Malaysia has done also well. We have introduced many things, but just that the people itself now should never be careless about the things that we haven't finished yet our war. I mean, like we still need to support ourselves, to protect ourselves, not just relying on the government to enforce any measures on us. And I hope that there will be new public health initiative by the government, by the authorities, by the universities and corporations, so that whatever crisis in the future, it will be solvable and brief for all of us to manage. I think that's all for my part for the preparation for the next future. And I think for the youth itself, I want to add more. I think in terms of financial literacy, I think it's very, very crucial, because as a fresh grad before, when the lockdown happened, I think it's very, very important that you need to make sure that your finance situation is on the right track. I mean, like you have to make sure that you prepare your financial, I mean, like your savings and all that, the emergency fund, for example. So when something happened like this, the COVID-19 and then the lockdown, and people will maybe lose their job. So you need to make sure that in the future you won't have to be as worse as you have faced right now. So I think that would be the point of view for this round. All right. Thank you.
Okay, all right. Thank you so much, Farhan. Okay, I think we are almost at the end of our session. What I can conclude is that we, the youth, we hold the future. So basically, we have to fully utilize all the technologies, and in this case, we have to fully utilize the big data, isn't it?
Yes.
All right.
Yeah.
Just like the previous session, we'll be having a question that will be asked to our viewers. So the question is very simple, actually, this time. Describe clearly what is big data and why is it important. I repeat the question once again. Describe clearly what is big data and why is it important? Okay, so bear in mind that there's gift for you guys if you have the most accurate and fastest answer. You can, just like before, you can answer the questions at the comment section of your respective platform. With that, we'll be moving on to our last round, of which we are going to have a Q&A sessions. We have picked several questions from our viewers, and that questions will be asked to our panelists. So the first questions that we have is strictly to our first panelist, actually, to Mr. Helmi. So we have a question from
Okay.
our viewers named Suka Cantik from YouTube. The question is,
Okay.
do you think Malaysian current initiatives are sufficient to handle this pandemic?
All right. So thank you, Suka Cantik, for the question. So in my opinion, okay, first thing first, Malaysia refer to the government or refer to, I mean like to the us, to the human being. So I will discuss it based on
Mhm.
the two perspective, based on the government or the authorities, and also based on us, the human being. So for me, what did the government do? I mean, like the initiative from the government or the authorities actually sufficient enough to handle this pandemic, particularly in the health and economic perspective. However, it is like all depend on us. Just like what Farhan said just now, the government may come out with like thousands of SOPs, thousands of prihatin packages, but if we are not, like we don't want to protect ourselves, then we actually like cannot handle this pandemic. I think like the other panelists like could add up I mean like the answer to this
Yeah.
question, because I think like um actually like the government did a lot, the authorities did a lot in order to curb or to tackle this pandemic. However, I the SOP compliance among us, I mean like the Malaysian, you can see, I mean like during the early spike of this pandemic, on back on February, March, April till June, everyone can comply to the SOPs. And now, even if like the
Yeah.
cases like keep on rising in Malaysia, it has up to like 36,000
Mhm.
cases. You can see like Malaysian like everyone just like if they want to go out just like to grab some foods, they will go out just like that. There's like no
Yeah.
more, they are not complying to
Yes.
the SOPs and whatnot. So I think
Yes,
the
exactly.
government initiative is sufficient to handle this pandemic, but ours is not that sufficient. We
Yeah.
have to, protect
Mm.
ourselves, wear masks, physical distancing, sanitizing your hands. That is like small matters that counts in order to curb this
Mhm.
pandemic. It is like all depends
Yes.
on us. Yeah, that is the answer for the first question. Government did well, and tomorrow, in the parliament, the budget 2020 will be tabled.
Mhm.
So we just like hoping for the best.
Okay.
The one of the main criteria of the budget 2021 is to revitalize the economy, to open up the economy back. So we just like hope for the best actually,
Okay.
to everyone. Hopefully, yeah, it will give like benefit to everyone. Yeah.
Mhm.
If
Right.
I mean like Muhammad or Farhan, you have like any like
Yeah.
opinion to
We'll
add?
love to hear thoughts from
Actually,
Muhammad and Farhan.
I totally agree that actually Malaysian has, I think I'm Malaysian now because I think I have previously, I think I have seen by myself how the minister worked at Sri Adhan Babel,
Yeah.
and every morning he will
Mhm.
have morning briefing with the team of the CPRC, if I'm second. So I think there's a lot of things that the government has done in terms of uh, providing how to say, like for example, like the budget, the economic stimulus by the government, right?
Yeah.
And also the SOPs that have been informed to the audience. But the thing is that we Malaysian, or maybe lots of people in the world, still in a state of denial that we are actually
Yeah.
in a phase that we have to accept this is the new normal, that it might be years, many years that we have to adapt this new normal. That's why the ministry has emphasized on the pembudayaan budaya normal baru. So I
Yeah.
think that is the thing
Mhm.
that has been emphasized many times, that we need, one way or another, we have to accept this, not because we have to wait until vaccine come. I think even though the vaccine comes, we are not sure yet whether the vaccine is the best solution.
Effective. Yeah.
Right.
Yes.
So I think it's very obvious that one way or another we have to live in this kind of new world, and we need to ensure that we protect our health. And as much as we want to protect ourselves, if we have that kind of mentality, if each one of us have that kind of mentality, I think uh, we will manage to curb this pandemic effectively, despite of we have limited resources or limited vaccine available in the world. I think that is something that we need to accept, that this is new normal and we have to live with it and never give up and never despair. Yeah, that's all. Yeah, yeah.
Okay, thank you so much, Mr. Farhan. What about Mr. Muhammad? Do you like to add up something to this
Yeah, I
part of
think
the question?
I'd like to add up a bit on the new normal, on the new norm part. I think it's a really good point. It's about
Mm-hmm.
he talked about Farhan talked about having vaccine, but we should bear in mind that vaccine is not exactly, it's not as if once you get the vaccine everything will be solved. No, because I think no country
Yes.
is rich enough to buy a vaccine for
We
each
need.
one
Yeah.
citizen.
Yes,
Yeah.
I mean,
exactly.
even in the UK, right now, the government plan is to actually only buy and give vaccine to those who are most vulnerable to COVID-19, because it's gonna cost a lot to vaccinize everyone. So I think that's one thing. So this incorporation of the new norm culture is really important. But I think it has to be balanced. I think the citizens, they have to play their part. They have
Mhm.
to try to the utmost best in order to adapt to this new norm. On the other hand, we also have to have a good a strong government. And I think now, because the situation is quite unprecedented, I think when governments face criticism, for instance, or maybe suggestion to improvise, they should not be too defensive about it. And I don't think it's not about
Yeah.
being defensive, because I think it's just a very new thing. No one has faced this before. So I think when people give
Yeah.
constructive criticism or maybe suggestions, I think we should adapt and incorporate. I mean, when we talk about the economy, I do have some suggestions. I mean, for instance, I'll just give a quick one. For instance, the bantuan prihatin in Malaysia, uh, it's a bit
Mm-hmm.
um, it's a bit of a one-off thing. Like when the first time PM Muhyiddin announced that he would give this much of bantuan to this many people, it wasn't as clear as Singapore. I mean, for instance, Singapore, it's not one off. I mean, they clearly stated that the stimulus that they gave was going to be for 9 months in three not installments, in three stages. So the first stage for the first three
Okay.
months, second stage for the next 3 months, and then the last stage for the final 3 months. So I think that kind
Mm-hmm.
of certainty is really important, so that there is no panic in the economy, and that's really important. Yeah, that's just one minor example, but I don't think just because you see this somehow a loophole in what the government is doing, that does not diminish what they have been doing all this while. So we
Yeah,
have to be fair, and the government as well has to be accepting and not too defensive about people's criticism, because this is just a new situation that we're facing, and people know that this is new, and people are not going to be too
Yeah.
mean about it, and just diminish everything that you have done. Yeah, so
yeah.
the balance has to be there. E-
Mm,
Everyone has to play their role.
that's true.
Okay.
Yeah.
Thank you so much, Mr. Muhammad. I hope all of the answers given by all the three panelists has reached the specification of the question. Thank you
Yeah.
so much. Okay, moving on to our second question. All right, so the second question is how quickly the public will embrace the new freedom. So this question, I think all the panelists can discuss on how the public can embrace the new freedom.
New freedom or new normal? I don't really get this question.
I think
I
like
think
the new
new
freedom,
norm.
meaning that
I think it's the new
when
norm.
I mean like when the pandemic is going to over, I think it is like about. I mean like the question is just about when we'll actually embrace the new freedom or the new normal. I don't know like what's
I
like.
think it's
Okay,
the new norm.
I think new freedom means that with all of the, with all the SOPs, so this is a new freedom that we need
Yes,
to.
Yeah,
yes,
yeah,
yes,
that one,
Yeah,
that one.
I think it's back to our first discussion that if we are still in
Mhm.
a state of denial, I would say that we do not accept that this is a new normal and this is a new freedom that we have to face one way or another. I think the quickly how quickly the public
Depend
will
on
embrace, I think, depends on ourselves. It's not depends on the government.
Yeah.
I think the government has played their part, but as a civilized society, I think it's a very crucial that we uh, need to understand that the responsibilities of our health is not just upon others, but also upon ourselves. I mean, like, we have to make sure that this new freedom is very well understood by all of the Malaysian population or all the people in the world. But just like I told you that the ministry has done the pembudayaan norma baharu, I think that one has been, very well established or very well run at the school. I think from the child itself, we want to start them to accept this new normal. So rather than they try to wait, oh, one day when vaccine comes, so I will be free again. I think when you say that this is a new freedom and this is the way that we have to live, and as long as we can still become someone that can contribute to the society, I think one way is try to protect yourself and to follow all the SOPs and also all the how to say, like, the new way of life that actually we all have to accept it in order to make sure that in the future, who knows, that when the time comes, everything will come back to normal, inshallah. I think so.
Okay,
I
what
feel
about
like
Mr. Helmi?
for Farhan answer is like brave enough, you know. I mean like actually how quickly the public will embrace the new freedom or new normal is actually like depend on us, depend on ourselves. If we actually, you know, can adapt to the situation, we will actually embrace the new normal or the
Mhm.
new normal lifestyle. Because it takes like
Mm,
21 days
mm.
to build a habit, and after that, it will be lifestyle.
Yeah,
So,
that's right.
Yes.
That's I like that.
yeah, yeah,
So
I
it takes 21 days to make a habit. I think I like it.
okay. Mohammed, do you have like anything to add up? I mean,
Yeah,
like
I
Farhan
think
has explained the
yeah.
answer, you know.
You know, you know how it's quite interesting to see the one leading the total number of cases right now are, so-called developed countries, the
Yeah,
US,
yeah,
the UK. And I think there was this book. I mean, sebab memandangkan, I mean, this forum is conducted by PDHJ. So I'm just gonna bring this up. So there's this book. It's called The Plague, written by this um, philosopher novelist Albert Camus. So basically, this was there's a fictional setting, and this plague. So basically, he explained how did this plague happen to a society that is too complacent. They think, oh, no way in our life, that Black Death is gonna happen again. The Black Death that happens in Europe, man.
yeah, yeah.
Yeah,
No
yeah.
way it is going to happen again. I mean, we are already this civilized people. We have this advanced medical technology. So no way, we are going to face another situation like that. But no, um, I mean, it is happening right now, and I think
Yes,
it
exactly.
is happening right now, and people are affected. And so we can't be too complacent. We can't be arrogant, and we have to be very wise. I mean, we have to embrace the new norm when facing this. So that cultural aspect is important as well. This awareness, this cognizance that this thing is indeed happening, and you have to recognize, acknowledge the fact, and you have to act in accordance, yeah, in accordance of that understanding. Yeah. That's it. Yeah.
Thank you so much for all the answers. I think that has answered the questions given, isn't it? That's pretty much has covered everything for that particular question, isn't it?
So
Okay, I
this
think
one,
we can move on to the last questions from our
Mhm.
audience. Right, so the last question from our audience is that your suggestion on what the youth can do to keep their mental and physical health at its best.
Okay.
who
Okay,
wants
that's
to
the
tell about
question.
physical health?
I feel like Farhan has to start first. You're taking, international
Yeah,
up.
because that's your score, right?
Yeah.
Yes.
I don't know actually. I think for the physical health, I think I'm still the one that's trying to do my best for my physical health. Of course, nowadays I think I try to brisk walk every day actually to make sure that I at least um, how to say like do some physical activity, even though it's not
Mm,
vigorous physical activity. But one thing that I think that very important is about the mental health. I think mental health is always something that we try to avoid, but it's in reality it's happening everywhere, and it's real. So, and in this time, I believe that many people have suffered so depression and also suffered from anxieties about what the future might be, especially the youth and the fresh graduate, for example. So, is it going to, at the end of the world or end of time? So, I think we should not be very pessimistic. We should, just like I told you, never despair, never lack of hope, never give up. I think we need to make sure that our mental health is strong enough to go through all of these things. And when you mention about the strong mental health, doesn't mean that you uh, have never suffered any kind of anxiety
You
or
don't
any
have
kind of,
any bad
yeah,
days.
or any depression or any bad day.
yeah.
I think it's fine for you to speak up. I think because of the culture itself, sometimes we try to suppress the feelings or suppress that kind of depression, which somehow we do not want to share to the people to tell them about how is your day or how we feel today and how do we want to share our problem. I think the communication is very important to make sure that your mental health is fine, and why not, if you, and the government has recently, Malaysia has introduced a new numbers of secretaries, if I'm not mistaken. So I think
Yep.
use it, and it's not about when you become mental disorder, you meet a secretary. I think no. I think it's the wrong fact that think that, oh, when I go to secretary, I have a problem with my mental and I might be crazy and I might go to mental hospital. No, I think you need to use the secretaries as not someone that as your friend, not someone who has the superior knowledge than you. I think we need to treat our secretary as a friend. That they are the one who probably the place that we try to to explain to them about our problems, and they will able to help us and guide us on the right way on how we want to deal with all the psychological problems that we might face. I think we must change our perspective about the secretaries and also seek for help or seek for counselors. I think we should make it normal to always find secretaries when you find that you cannot hold anymore, or to find someone to talk to, rather than you keep everything at yourself. I think mental health is very important. If you do not have a very good mental health, I think your physical health will also be affected. For example, if those who have a very sort of like distraction in their mind, I think they would not have a very decent uh, uh, appearance, I would say, because of there's something problem inside their mind that they haven't resolved yet. So I think before we try to we need to keep balance between these two aspects, the mental health and also the physical health. And yeah, I think the one thing that I should emphasize more, I think, is about uh, the the time that we all need to think that seeking help for our mental is important, and there's nothing to worry, there's nothing to be ashamed of. And I think it's fine to meet your secretaries at this time. Or after this, you can try to book appointment with the secretary to tell about
Mm.
whatever problems you have. Yeah.
Yeah, I think that's a really good point, because I think one of the brightest side of facing this pandemic, I'm not saying it's a good thing, but one of the brightest side of facing this pandemic is that people are not ashamed to admit that they are in trouble, not just mentally but
Mm.
also financially. I mean, it's quite interesting to note that previously, before the pandemic, when surveys were done in certain rural areas, even in urban um, poor areas, low income areas, that when surveys are done, sometimes people are just ashamed of disclosing their socio-economic situation and everything. But then we can see that there's a difference. I mean, after the pandemic happened, when the same survey was done, people were actually quite open about it, because we all know that everyone's in the same boat. So just seek out the help, right? Yeah, I mean everyone's in the same boat. Yeah. Um,
Yeah.
Yeah, and I think there was this comment that says it's quite disappointing to obey the SOP, when we have to obey the SOP, when some of us can just simply go beyond it. I think, of course, that's also an enforcement issue in Malaysia, and I'm not pointing finger to any side. I think
Yeah.
Politicians had it quite easy, especially after the PRN Sabah. I'm not pointing to any side. I'm just saying politicians in general had it quite easy, and I think this is quite disturbing. People are quite outraged at this, because enforcement has to be fair. So that, I mean, politicians are usually the one holding the leadership positions, and leadership by example is really important. And I think
Yeah.
I understand the sentiment and where they come from, and I think the one in charge should be more cognizant and aware of this outrage among the people.
Yes.
Yeah, it's something we can improvise on.
Yeah.
All right. I mean like as we can see in this world, people often treat mental health as not important as the physical health. We are told like every day we have to exercise regularly, having a diet. But then whenever it comes to mental health, we will actually we are becoming pessimistic. Just like what Farhan said, we don't often like treat mental health important as important as the physical health. So I mean, like mental health is very important because if something is not like playing in your minds, just like Farhan said, you can sense that someone is not right because there's like something in his or her mind. And then about the mental health as well, I literally I did join a class basically during the pandemic, previous pandemic during the semester
Uh-huh.
break. I did take a course about the mental health, and the course is just like about 4 weeks. 1 week, it will have like few lectures, and then you will listen to a sound of which that is like a relaxing sound, the exercise that you can do to actually keep your mental okay. And then once you have done for the first week, it will end up with like question that you have to answer. I think that is like very good that everyone like actually could enroll in that class. Doesn't mean that you have mental health, you are crazy. That is like what
Yes.
people think. If you have mental health, then you are crazy. No, it is like not like that. You have to you have to treat your mental health as important as your physical health. And like Farhan, likewise, like
Yes.
Farhan, I'm me too. It's like working on the physical health. Okay. And then
Okay.
just bearing like our mind that
Mm-hmm.
we have like different struggles. Everyone is struggling, and it is
Yes.
okay to speak up sometimes. And we have to physically distance, but not socially distance.
Mm.
Yeah.
Yes.
Communicate with your
Exactly.
family, your loved ones,
Mm-hmm.
your siblings.
Mhm.
That is the reason why Malaysian has like shift the term from social distancing to physical distancing. We should not
Yes.
socially distance ourselves, but we have to physically distance ourselves. That's
Yes.
it. I think
Exactly.
that's it.
Yeah,
Yeah.
just be kind, check up on people.
Yeah,
Hashtag.
yeah,
Yes.
Yes, kita jaga kita. I think that's it.
Okay, all right. So I think that will be all. I think that pretty much covers up the question, isn't it? Okay. So now that will be the end for the Q&A sessions, and we are going to proceed to the next part, of which we are going to look at a video from PDHJ regarding the UiTM Digital Library app. But before that, I would like to remind to our viewers, please sign in your attendance at the link that has been provided at the comment section of your respective platform. So now we are going to watch at a video that so basically that's the video that has been prepared by the PDHJ. So what I can conclude about our discussion is that basically it is completely up to us, the youth, and everyone else, not focusing on the authorities as the part, but we play the most important role in combating this pandemic. That's for me, that is the biggest point for the whole entire discussion, isn't it? I think we have reached the end of our discussion actually, and basically I hoped all of our viewers, you've learned something by joining this session. I hope you have increased your awareness about this pandemic, and basically I think that has covered everything, isn't it?
Yes.
I think that will be the end of our discussion for this evening. I hope everyone has enjoyed their time. Thank you so much to all of our panelists for this fruitful discussion.
Yeah. Thank you so much.
Thank you so much
Thank
to
you.
Mr. Helmi, Mr. Farhan, and Mr.
Farhan
Muhamad.
and Muhammad.
Yeah.
Yes, thank you, Helmi and Farhan, as well.
Nice to meet you all.